All right, let's dive right in. We're going to give you the essential need-to-know info for using labetalol in a hypertensive emergency. This is your quick, confident guide. Let's do this.
Picture it. You're in the middle of a shift and you glance at the monitor. A patient's blood pressure has shot up to 220 over 120. That's a crisis. Every single second counts. So what's your move?
In that exact moment, you need something that's not just powerful, but also really precise.
And that, right there, is where labetalol comes into the picture.
So what makes it so good for a situation like this? Well, it all comes down to its unique, dual-action design.
So what do we even mean by dual action? It's actually pretty cool. Labetalol is working on two fronts at the exact same time. It's blocking both alpha and beta receptors. This brings the blood pressure down without that rebound spike in heart rate you can sometimes see. It's kind of like a smart 2-for-1 deal for a really big problem.
You know, here's an easy way to think about it. Imagine your circulatory system is just a big city full of roads and traffic. The alpha blockade part, that's like widening all the roads, making more room and decreasing resistance. At the same time, the beta blockade is slowing down the cars. That's your heart rate. It's this 1-2 punch that makes it so darn effective at lowering blood pressure safely.
And here's a key little detail to file away. While it does both jobs, labetalol is actually a stronger beta blocker than it is an alpha blocker. What that means is it has a bigger effect on slowing the heart than it does on widening the blood vessels. That's a really important distinction to have in the back of your mind.
Okay, so we've covered the what and the why. Now let's get into the nitty-gritty how. Because when you're in the heat of the moment, you need a clear, simple protocol. So let's break that down step by step.
In a hypertensive emergency, speed is everything, right? And this is where labetalol is just fantastic. It starts kicking in within 5 minutes, it hits its peak effect at around 15 minutes, and get this, it can last for up to 18 hours. That's exactly the kind of fast, sustained action you need. So what's the game plan for adults? You're going to start with a 10 to 20 milligram IV push, nice and slow over 2 minutes. If that doesn't do the trick, you can repeat or even double that dose every 10 minutes.
But, and this is a big one, you have to remember the maximum total dose. It's 300 milligrams. That number is a critical safety limit. You absolutely need to have that one memorized. No exceptions.
And just a quick but really important side note here. We've been talking about the adult protocol, but when it comes to pediatric patients, the safety of IV labetalol hasn't been established, so that's something to be very aware of.
We've got the protocol down, but now we have to talk about what is, without a doubt, the most important part: safety. Let's walk through the absolute must-do checks before and during use.
First things first, let's talk about the absolute deal breakers. These are the situations where giving labetalol could be incredibly dangerous. These are the hard stops.
So you should never, ever use labetalol if your patient has bradycardia, hypotension, a heart block greater than 1st degree, asthma, cardiogenic shock, or if they're hemodynamically unstable. And listen, these are not just suggestions. They are strict, hard and fast rules. Okay, so you've done your checks, you've given the drug. Are you done? Not even close. Now your job is to be a hawk, watching for any adverse reactions as the medication starts to work. So what are you looking for? Well, the most common thing you'll see is hypotension, especially the kind that's related to the dose and shows up when they change position. You also need to keep an eye out for bradycardia, dizziness, headache, and sometimes even shortness of breath or a little nausea. And you also got to be aware of how it plays with other drugs. For instance, if your patient is on a beta agonist, labetalol can make it less effective. And if you give it with nitroglycerin, you might get a much bigger drop in blood pressure than you were expecting. All right, let's wrap this up with a few really important nuances. We're talking special patient populations and the absolute necessity of continuous monitoring. Labetalol is a really important tool for managing hypertension in pregnant and postpartum patients. Generally, IV is for the acute crises, and the oral form is for chronic, long-term management. But remember, the same stop signs apply. You have to avoid it in pregnant patients who have asthma or heart failure.
Okay, if you only take one single thing away from this entire explainer, please let it be this. Continuous monitoring is not just a good idea, it is absolutely essential. You're dealing with a powerful medication and you have to track what it's doing in real time.
So what does that look like practically? It means you have your eyes glued to their blood pressure, their pulse rate, and the ECG. You're also actively looking for any signs of heart failure or bronchospasm. Constant vigilance. That is the key to using this drug safely and effectively.
So, there you have it. That's your crash course on using labetalol in a hypertensive emergency. We've hit the what, the why, and the how. The only question left is, the next time you're facing that crisis, how is this knowledge going to change your practice?